This is your general physical exam form. You will find that in your case doctor's office, and it has all of the items that you will need to perform, with a few exceptions that Chris will add in as he goes through the procedure.
Okay. Start with this. Hi guys. Okay. We're gonna start with the vitals. Guys, as you're doing your physical, it's no problem in the clinic going off this list. It's obviously a lot of stuff. So we want to make sure that we kind of have a flow that's going with our patients. And of course, we'll be practicing on our student patients and then outpatient. So we're going to start with vitals. Height and weight were already taken. In each hall down in the clinic that there is a scale for you to use, okay? We're going to do temperature. You're going to see lots of different ones going around. This is one, you're going to see one that where you just put on the temple. This one will go across the brow, but in either case, we don't have to be putting anything in anybody's mouth now, okay? So we're going to take Alex's temperature. You just look right forward for me. Okay. And we're just going to write that down. Okay, so we'll do that. And now we're just going to do pulse, so we're going to make sure that we do left and right, so you can just ask your patient. And for guys, and then I'm assuming girls also, I mean, we are working with a female patient, so constantly we're going to be thinking about instructions. We're going to be making sure that they're comfortable and everything else. So she's just going to, Alex is just going to relax, and then we're going to take this pulse. We're going to look for a clock, which we have right on the wall over there. Great, so now, easiest way to do pulse, we just got 34 and 30 seconds, okay, and we multiply by 2. That's the most efficient way both for you and for your patient. And we would go and now do that on the other side, and we'd make sure to mark our physical exam form. Blood pressure. Okay. Blood pressure, guys, if you remember from his exam, we want to find that set point, and we want to go from that set point. It's not really like so much like your practical exams where you have to like tell them you're doing that. You're not even really know that they're there when they're evaluating you. So you can just kind of go through, do it. The most efficient way that I found, of course, is to start from the set point. Alex. So we're just going to be putting this here. And blood pressure, of course, is done bilateral. And you're going to see that. You're not going to forget to do these things because as you're looking through the sheet that Dr. Bullis just showed you, it's going to remind you. You're going to do the left and do the right. All of these blood pressure cuffs, again, these are going to come in various shapes and sizes, colors, and everything else. Almost all of them have arrows where you're going to put it right under the brachial, over the brachial artery. Okay, if you guys remember, you can just relax. We're going to find set point on Alice. We're going to make sure this is closed. We're going to do that. Alice, just let me know if you're uncomfortable or anything, okay? So she stops right at 125, and if I remember correctly, we add 30. So we're going to be taking the blood pressure from there, so we're going to actually let that out. Okay, never leave it on the patient. Now take blood pressure, we're going to listen. I like to not only listen, but also look. There's a lot of people out there in the field, we don't do that here, but they'll not even listen, but they'll just look at it, and that's how they'll get their systolic and diastolic, okay? But we'll do both. You really care for your ears?
What'd you say?
Be very careful of your ears with this thing.
Oh.
Yeah. Me and the buddies have hurt ourselves. Long story. Sorry. Okay. Okay. Let's just gonna relax. Notice I'm about 1 inch above, guys. And for more specific and accurate, you could always look at Dr. Gibbons' videos too. We're gonna start up there at about 155. And then we're just gonna let it go down. Not too fast. There it is right there. Heard it and saw it. 122. And 76. 122 over 76. And you guys saw how it just started to actually relax right there at the end too. So that for me tells me that confirms for me that I know that I just got her blood pressure. Now we're going to do this bilateral. That's really important. And something cool, guys, we have the opportunity to kind of do case studies with all of our patients here. So this is something, if someone's not only interested according to technique, but if you can track this and use this as one of your objective outcome measures, if someone does have any kind of hypertension or anything else, and you can just track this over time that you're caring for people, it's pretty cool. Because you will see changes. Little tidbit. Let's see. So there we have temperature. Okay. Respiration, guys, I wouldn't tell her I was doing respirations. I would say, oh, okay, now we're doing pulse on this side, right? And then we're just going to watch. Really, really important because, you know, unless you want to fake it to make it, which a lot of us do in order to actually see the breaths, we want to look up here. Because a lot of times, especially Alex, you can tell from her pulse and her blood pressure, she's very relaxed right now. Far more relaxed than I'd be if I was a patient right now. So,
Are you
I'm
telling me I'm not in good hands? Then maybe cut
right,
this.
right. Cut now. So, okay, so instead of just looking at the front, we're actually like kind of looking at the top, but she doesn't know it. Okay, so she thinks that we're taking the pressure again, and we're doing this by time again. Okay, guys, that was 6 breaths. Again, we're going to do 30 seconds times 2, so that's 12 breaths, and that's well within normal range. And I believe that is all of our vitals. Yes. Okay, now we're going to go into posture. Now, these are some suggestions, guys. A lot of times we look at these sheets, and I know that we did, and we really didn't know what to use all of these for. This is a little crumpled. I apologize. Something I was just preparing for today. Yeah, if you don't mind. Thanks. This is a nicer one Dr. Bowles has for us. Again, just kind of like our other sheets, these are things we need to do and they're suggestions, but also something that's very helpful is that if you look in here and then you fill these out, okay, that's a good thing. But in addition, what you can is use this section where you're listing your postural findings, which are, you know, really important objective markers that you'll be looking at, re-eval times or more if you wish, and then you can show them on here, okay? So we can take a look and we can do posture right now with Alex, and then what we'll do is our big findings, we're going to list them here, and then we can also, if we wish, show them, okay? Okay, Alex, so I'm just going to have you stand up for me. Okay, guys, one easy way to do this, see how Alex is already kind of in the middle of the room. You can have her kind of do the dance and the step, right? And then have her eyes closed and then either stay closed or open and not move. And then that way you don't have to move her, but you can kind of just move around her to get all of your findings. So first thing we're going to do is we're going to ask Alex to look forward, and we're going to ask her to close her eyes, and then we're going to just watch our patient, right? You know, be careful like with the wrong person stuff. And so you're just going to kind of march in place for me, Alex. Yep, get those legs up. Yep, good. And then just relax, yep. And then good. And then you can look forward to what feels is level with the horizon or straight for you, and then you can open your eyes. And then please don't move. Okay? So, first thing we can go, and since we're right here, we can go from the back. We're looking at shoulder height. We're looking for spine, anything that we're seeing from a P to A point of view. Usually we're looking at shoulder. We can, we're in A to P looking for head tilt, but we can see it this way too. We can even see a little bit on the left from here. Okay, we want to come down. And if it's okay, Alex, I'm just going to be palpating your hip bones. Okay, so I'm going to be coming in the side here. This is usually the best place to do this. We can see she's got her right high. Okay, so we're high here, high here. And these are just findings, guys, and these are things that come in that are not only very helpful for the patient, but fun in investigating and helping the person function better and to watch these things go. Now we're looking at her legs. We like to look at some Achilles. These are things that we'll talk about that we'll get in active rehab. We're looking at her Achilles, which look nice and straight. I'm going to go to the front. She's going to continue looking straight without moving. Since we're down here, I'm going to check her arches. More flat on the right. That's just something to think about. We want to note that down. That can affect pelvis, of course, and things like that. So we're just looking symmetrical there. And she's going to continue. She's going to try not to look at me, which is kind of like hard for the patient a little bit. But you really want to just take a look at her. And that confirms just a slight left head tilt, which you want to think about. And then we see a very, very slight right facial prominence. Okay, confirmed. And then now we're going to come from the lateral. And we will see her EAM is actually right over her GH. She's doing great as far as forward head posture, especially for students, so that's fantastic. Now we're also going to see, and if you haven't gotten this already, you're going to get this in class, plumb line this way, plumb line this way. And we're just taking a look down, and I'm just going to palpate again your hips if that's okay, Alex. Sure. I'm looking at greater trochanter. That's looking pretty good. I'm going to feel in here, just kind of a gross look of our curves of what we're dealing with. We're seeing how that lines up with the lateral condyle, femoral condyle, and then all the way down to the lateral malleolus. And posture-wise, Alex looks pretty good. So we're going to mark all those things down, and then again on the sheet we can show them. And these are all things that we can look at as we move forward. These are one of our objective markers. Okay, gait. Gait is part of our neuro assessment, okay? You won't be able to see on the video, but what we're going to have to do is we're going to have the patient walk, and they're going to walk down the, yeah? Okay, so we will. Alex, if you can come out here for me, and then Dr. Bull's going to follow us.
Follow you now?
Yes, you're going to come out right here.
Okay.
Okay, this is another great objective marker, guys. This is stuff you can talk to a lot of docs about, and this is to start telling us information about the neurology. Okay, again, these are the certain part of our objective outcome markers as we're moving forward and looking how the patient is functioning, okay? And we'll actually see these things change over the course of time. It's pretty cool. So now we're just going to ask our patient, Alex, what you're going to do is, do you see that other room kind of over there, right, that doorway? So you're going to just, just like you would not walk any other day, you're just going to walk down there. Okay. You go ahead. Yes, you can start. And now I'm looking for pendulum of the arm swing. Guys, you can see right now already. You see how there's a little less on the right? That tells us something. We're looking for flaring of the feet. You can come back, Alex. We're looking at seeing how the heel strike happens, the toe off. We're seeing how the foot is. Is it long strides? Okay, you can do that again for us if you don't mind, one more time. We're just looking for like even strides. Is it difficult? Is there any apprehension? All of these things start to play a part, and then you'll dive into more of these things in class. So on her, we can see right away that she has good. Her feet are forward. She has a confident walk. Stride length is equal. All we're really seeing is some pendulum on the left is a little less. Head is straight. Thank you, Alex. Okay, so that's our gait. You can have a seat again. Let me move these papers out of the way for you. Okay. Now, guys, we're still on the front side of this thing. okay? All right? So we're doing this together, okay? All right. I remember the first time I did physical, there was no air conditioning. Remember that? Oh, jeez. Okay, so now we have our posture assessment, initial posture assessment. We have initial gait, we have our vitals. And now we're going into range of motion, of which we're going to use a goniometer. Okay, guys, you're going to see on this sheet, okay, I don't know what the exact ruling is on this, but I have yet to see someone able to do thoracic specific range of motion. So usually what you see is, that might be up to your case doctor or something, but usually what you're going to do is with the goniometer, you're going to do the cervical, and then you're going to do the lumbar.
We typically exclude the thoracics because you can't really separate those from the lumbars very well.
Okay. So, I mean, feel free, you know, and this box, okay, so first, feel free to kind of get this out of your head to focus you as you're going through your exam. And this box I have yet to use. It's nice that the space is there, but I have yet to see anything that's specifically for. I think this is just for in case someone finds something else to utilize it for. So we're looking at these two sections. Okay. And then, of course, guys, if you have somebody coming in with an extremity complaint and your case doctor and you guys are working on that, you're going to examine that just like you are going to examine the spine. So you're going to be doing hip-renal, range of motion, and stuff like that. That's not here because that's not a part of our basic functional assessment right now, okay? And you'll work with your case doctor on that. Just like when we get to the backside with orthopedic testing, even though those are the tests that are there, you're not limited to those tests. We've learned hundreds of tests, right? There's a reason we learn that. So you're not just limited to that, but you'll be utilizing that according to your case doctor's direction, etc. So for range of motion, goniometer. And now I'm just looking at this because they all are different. Okay. Basically what we're looking at, the angles. I know we haven't gotten much of this in class, okay, but we're learning kind of as we go. Okay, so the first thing we're going to do is, we're actually probably going to have Alex sit, so it's okay, you're good right there. I'm going to just bring this over. Okay, and then Alex, you can come over here, sit right in this chair for me. Okay guys, the first thing that we do is that we are going to be, Alex is already, she's a great patient, she's already looking forward. Now what we're going to do is we're going to check all the range of motions that we know. We're going to do flexion, extension, lateral flexions, and range of motion, or rotation, okay? So first, to do flexion extension, you can be on either side of the patient, whatever you want. This might be easier so you can see. We're going to start off. Now if you notice, this is her normal, right? So this is up and down straight. We're going to start there, and what we're going to ask is for Alex, if you could bring your chin to your chest and you can kind of go down as far as you can. Now see how the one goes with it, guys? And we're right about there. Good. You can relax. Then we record the number. And it's nice because on the sheet it does give roundabout normals. So it's really nice. Automatically you can start seeing something, and this is something that, you know, as we've learned from Dr. Fuel, every single patient is going to be concerned with. This is yet again another great objective marker that you're going to be utilizing a whole lot. Now we're going to do extension. Okay, Alex, and now I'm going to ask you, by only move your neck, to look up to the ceiling for me. Good, as far as you can go. Not hurting yourself. Right. See how she got so much more, guys? You want to ask them as far as they can go, and that's really good. Okay, and then relax. Good. Then we record that number. Now to do, that's flexion extension, to do lateral flexions, we're going to stand behind the patient. Okay, the same concept. And guys, do the best you can to remove variables from all of this, right? There's other more expensive things we can utilize more in practice. We can use, many doctors just use these, some doctors use their eyes. But the point is, I always try to make sure that I have the same place on every patient every single time I do this to remove variables, okay? You'll notice as you're working up patients over the course of time, you'll be like, oh wow, look at this. I'm going to test range of motion today. Wow, they have an increase by 20 degrees in right rotation. Isn't that awesome? And then that's something you show them, and that's something that you're writing down. You know that they're functioning better. You're affecting their bodies in a good way. Okay, so Alex, now what I'm going to ask you to do is you're going to take, when I tell you, you're going to be taking your right ear, bringing it to your right shoulder without lifting your shoulder. Okay? Go ahead. And now I see how I keep that one on my left hand straight, and we're right about there. Good, you can relax. We can record that. And now we're gonna do the same thing. Alex, going to the left, please. Good, and relax. And guys, you might even be able to see from there how much decrease or right lateral flexions. Okay, so now to do rotation, we're gonna be on top, like this. So we're gonna start off straight. I like to keep the center right on top. And again, Dr. Becker will go into this much more, you guys. Okay, so now what I'm going to ask, Alex, is for you to turn your head to the right as far as you can without moving your body, though. Okay? Go ahead. And that is excellent. And good, and relax. I'm going to record that number. See, this is very easy to use, guys. And Alex, we're going to do the same thing to the left. Good, and relax. Okay, a little more to the left. Great. So that's our cervical range of motion. Now we have that information, we know that we've done it accurately, we've removed as many variables as possible, and now this is information that we have to continue to monitor over the course of the time with the patient. Now to do the lumbars, Alex, we're going to have you. Yeah, you can get up and get up right on yours. Probably be fine because I'll be able to see pretty good. Yeah, I'll move this out of the way. Okay. Hey guys, range of motion for lumbars. Biggest thing I think to be able to help them is that we're going to hold their pelvis. Okay, you're going to either see this done standing, depending on it's passive or active. Most of the time, the biggest thing we're doing by far is active to see what's going on. You know, is there pain? Oh, and I forgot this. You always want to ask the patient, is there any pain with something that they're doing? Make sure that they know that we can always communicate that. And that's important to know too. That's a big finding too, if they have pain turning to one side or going up or down or something like that. Okay, so first we're going to have Alex cross her arms. Okay, and then Alex, we're going to have you turn. Now what we're going to do is I'm going to be, if it's okay, I'm going to be holding your hip bones, okay? And you're going to be turning like this. And you're going to be going like this. So we're not moving your hips at all. We're just turning like this and turning like this. Okay. And for this, guys, it can be a little harder.
Can I turn this way so they can
yes.
see how you hold the pelvis and use that goniometer?
Yes.
Okay, perfect.
And we're going to do this two ways, guys, because if you want to use the goniometer, you would need two people. So what we'll do is first we're going to look at the range of motion, see if there's any pain with it. And so I'm going to now go and post. There we go, and we have it. Okay, now Alex, we're going to ask you to turn to the left. Good. Any pain with that?
No.
Okay, come to the center and then turn to the right. Okay, and come to the center, and that looks pretty good. It looks pretty even. Now, guys, in order, obviously, if it's just you, you can't use the goniometer to do that at the same time. So then the other way to do that is we are. I'll probably have to have you back in the chair to be able to do that.
Okay.
Okay. Yeah. We'll just do the rest right there so you can have a seat there. Now, guys, how we're doing is kind of like how we did the cervical. So she's going to cross her arms again. Now, do you know how that just felt?
Yes.
Alex, where you didn't move your pelvis?
Yeah.
Well, I'm going to ask you to do the same thing again when you're in the chair.
Okay.
Okay. So first we're going to start off by going to the right.
Okay.
So we start off nice and straight. Go ahead. And relax. We're going to record that measurement. And now we're going to do it to the left. And guys, you might even be able to see from there that how much more she has to the left. And she does, about 20 degrees. Okay, and relax. So we have that. To do in the lumbars, it depends who you talk to, you know, if they're going to do it seated or standing, but most of what I've seen is people doing it standing. So we'll have you stand up. And you guys have a class on this too where you run through it. And then, so yeah, so this is fine right here. So what I'm going to ask you to do is to kind of just go down and touch your, if you can, to go as far as you can in front of you.
Okay.
Yep, and go down just like that. Okay, so we see no problem there. Any pain with that? No. Good. She's going to come back up. Now she's going to, she can either cross her arms or not, whatever's most comfortable. You kind of want to be careful with people aren't used to doing this. But now you're going to kind of, yep, and now you're kind of going to just extend back, Alex, just as far as you can. And she's got great range of motion. Okay, and then you're going to relax. And the last one is lateral flexion. And then she's going to take this one, and you're going to ask the patient to take that arm and slide it down their leg as far as they can. So go ahead. Good. And then come back, and then go down to the left. Good. Now, all that, guys, we're going to be doing with the goniometer. And for flexion, right, is this way. For extension, right, is this way, right? So you're doing your best to go with the angle of the body. They're done when you see them starting to recruit other muscles if they're doing that to kind of try to get the movement in there. A lot of times people are going to try to like impress us when they're doing these kind of things. Lateral flexion in the center, down this way. Left lateral flexion down the center, this way. Okay. So that's our ranges of motion. Okay. Now I believe that might be our first page. Whew. It's hot in here, guys. Okay. Yes, it is. Oh, and in case there's any confusion, guys, so most of the time, if there's a very centered case, doctor will guide you, but most of the time it's active. And please, Dr. Bowles, if I say anything, please correct me. And then we have the left and the right, so it's very easy. And then you have these for comparisons as you're moving forward. You're going to have to put them in your PMR and things as you're moving forward anyway. Same thing over here. Okay? All right. Now, page 2. All right. Let's do it. Okay, so, guys, we can run down the list. I'm going to just say some changes. How we're learning it in phys exam, some of the paperwork hasn't maybe caught up, so sometimes that can be a little confusing, so we'll talk about that as we hit these things. Okay, but we're going to start off now. We're on the second page, as Dr. Bull showed you before, and we're going to run down here, and we're going to start with the cranial nerves. I'm going to check if we have smellies. I don't know if we do. We're going to run and get them. Or just yeah. Okay, guys.
Coffee.
right.
Kombucha.
Kombucha. So we have coffee and kombucha here. So okay, if you guys don't get this, it's a problem with cranial nerve 1. Just saying. Yeah. Right. See, there they are. We weren't kidding. Dr. Bowles and I have interesting
Testing methods.
yes, testing methods. Okay, so guys, the smellies, right? So the first thing we're going to ask cranial nerve 1, we're going to run right down the sheet that you guys have, is we're going to be just ask them to close their eyes, explaining to the patient that we're going to be smelling certain things left and right. And so first we want to make sure that the nares are clear, right? So we're going to ask you, Alex, with your eyes closed, to just, cover your right nostril, good, and just breathe in for me. Good, and that's okay?
Yeah.
Okay, and now just do the same thing with your left, please. Good. So now we know that they can smell, right? We want to make sure that we will see people that can't do that for whatever reason, including the common cold, right? So as we do that, then what we're going to say is, okay, Alex, please tell us what you smell in each nostril, right? So we're going to be taking the coffee. Now I just want you guys to know this is some of the best coffee there is. So if she doesn't get this, we're sending her out to the ER. No. Okay. So
I might not get it.
Yeah. So what we're gonna do is we would have the smelly here, guys, and a lot of times actually, right, it is the coffee or it's the mint or it's something that's identifiable, right? So then she would breathe in through that nostril and say, okay, what do you smell, Alex? She's gonna tell us. We do it to the right nostril; those should be the same. Okay, and then we're going to do that with usually 2 to 3 times is what I've seen is good. And so that's testing the cranial nerve 1. Okay, when you guys see, when you're coming down here and you see peripheral vision, I think I'm going to have her back in the chair, and we're actually going to have her right in the front. That's okay, Alex. You don't mind getting down here for us?
This is quite an exercise.
I know,
I didn't
right?
know I was going to have exercise.
You were coming in for a physical, and you. Okay. Yeah, and guys, you'll see as this get better, because you're in different rooms, you'll get used to different rooms, you get used to different things, and you're going to be in your own hallway, so all of those logistical things kind of get worked out as you're doing it too. But now we're going to peripheral vision. Okay, this is just written different maybe than what it is in the notes, but this is the one where we're going to be asking the patient, we're testing the peripheral vision, to look forward and not moving their head and just tell me when you see my fingers, okay? So then we're going to go here.
See it now.
Okay.
See it now.
Okay.
See it now.
Okay.
Now.
Okay.
Now.
Okay.
Now.
Okay. And then one.
Now.
One on top. So remember that, guys. I remember Dr. Gibbon. And again, for very, very specific information, we have the videos, we have our notes and everything else. Okay, that we want to check that, and we want to make sure that there's one on top. Okay.
And Alex,
Yes.
did your class learn it from the front?
We also learned it from the front.
Okay.
Oh, really?
Mhm.
Yeah.
Oh, we didn't.
Yeah, so
Interesting. Okay.
you may see it both ways downstairs.
Okay. Light reflex, guys, direct and indirect. I know my entrance exam, it was called light reflex, and a lot of us panicked because we didn't know what that meant. For me, guys, I feel like I don't really need a pen. I feel like using our tools here that we're going to use anyway kind of just makes things flow a little smoother. So what I'm going to ask Alex to do is to take the ridge of her hand and put it on the ridge of her nose. Now you'll see someone do it that way. You'll see someone bring it off to the side, off to this side. The main thing is that the light can't get into the other side, because you got to check each pupillary reflex, okay? So I'm just going to ask her to look forward. I'm looking at the pupil. Strikes. I'm going to come around this side to do the indirect for this eye. And I'm going to have her just bring her thumb in. Good, just like that. Good. Now I'm going to come around here, guys. Do the same thing on this side. Good. It's quick. And then we're going to come to this side. Good. So that's our light reflex, which most of the time you learn as direct, indirect, are the same thing. Accommodation. One of the easiest ways without you having to move again, you can kind of just shift in your chair if you want, Alex. Accommodation, guys, if you remember, I'll never forget the Dr. Gibbon videos with the fire extinguisher. So we always call this the fire extinguisher move, because if there's a fire extinguisher and the wall is possibly 15 feet away. So 15, 15, okay? So instructions to the patient. Okay, so Alex, do you see that sign on the wall there? That's right there? Okay, good. And I'm gonna have you look at that. And then when I tell you, I'm going to want you to look at this, which is going to be a little closer to your face. Okay? So look over there at the sign.
Okay.
Now look at this. Good. And now we're going to do the same thing on this, guys. I know it's maybe kind of hard to see. Again, look at the sign.
Okay.
And now look at this. Good. So that's accommodation, guys. Easy way to do it. 3, 4, and 6, cardinal fields of gaze. We're testing muscles, the ocular muscles of the eye. So now, what's the best way to, probably this side. So what we're going to do, guys, here is we're just going to ask the patient, Alex, I'd like you to follow this, the tip of this, with just your eyes and not your head. Okay? Good. Now just follow this. Guys, notice one thing, that on the side, you want to hold on each spot. Hold. One of the big things we're looking for is nystagmus, which is a very important finding, obviously. We'll come back to center. Now we're going to come over to the side. Come up. Doing great. Good job. Now, guys, and most of the time we learned it in physics exam. At least we did convergence doing it at the same time. You're going to see on the list that it's like 7 things down. Just do convergence right now. It's no problem. You can check it off. Our concern, right, is it normal or abnormal? So after our cardinal fields of gaze, okay, now just continue to watch this for me. Okay, guys? So, and even though that's down the list, we know that we just did convergence again for the flow of this thing, right? So you don't have to feel like you're all over the place and going to do the same thing again. Okay, we know that 3, 4, and 6, ocular muscles look good. Boom, we're checking that off, normal, and we're going down to convergence in this example where it's down maybe 8 things and that's under the eye, we're checking that off because we know it's normal, okay? Okay, trigeminal nerve, sharp, dull. Okay. I was going to be honest, I don't want to touch your face with that because I wouldn't want my face touched with that. We wouldn't do this.
Perfect. I already have issues, as you can tell. So
No.
having
Are you
more.
kidding me? I really can touch my own face. It gets crazy. Okay. Okay. So Alex, what I'm going to ask you to do is that, do you feel this?
Yes.
Okay. So I'm going to have you close your eyes. Now, so you know, and guys, be really instructions with this is important because we're touching someone's face, and I got to tell you, I mean, for me, the first time I got a physical, I needed to know this was happening. So just kind of keeping it real there. Yep, Alex, our patient's going to close her eyes. Remember, we're going to hit the 6 points, okay? And we're going to ask, Alex, do you feel this?
Yes.
Does it feel the same as this?
Yes.
Do you feel this?
Yes.
Does it feel the same as this?
Yes.
Do you feel this?
Yes.
Does it feel the same as this?
Yes.
Good. Open your eyes. So remember, that's one thing, guys. And sometimes you'll hear people say that, okay, do you just, they're just asking, do you feel this on each side? Again, for these very, very, very specifics, these are things that, you'll work out either, in your own mode of doing things. But those specifics that we're thinking about academically that, give us points on test are kind of little less looked upon now. We want to know if this is normal or abnormal. I mean, these are patients, okay? So that's kind of like some of the change that I've seen happen going from that to this, if that helps at all. Okay, so then we have our dull sharp, right, guys? Remember, this one's random, right? So now, Alex, do you feel this?
Yes.
Okay, and do you feel how that's different from that?
Yes.
Okay, so we're again going to have you close your eyes, and if it's
Okay.
okay, I'm going to be touching your face with these 2 different things. I want you to tell me if it's dull or if it's sharp.
Okay.
Okay, now is that too sharp?
Actually,
Feels
it almost
pretty
feels the same.
sharp, does it?
To me, it almost feels the same.
You could use the tissue as your soft. A lot of people do that.
Yeah.
Just
feels...
poke. Just honestly.
All right. Feels sharp to me.
No, that actually
It
does
does.
not feel sharp.
It feels so sharp to me. I can't put this on your face. No, okay. Okay, we'll get it
We'll
done.
pretend. We'll
Okay,
pretend
get
that
it
I
done.
feel sharp.
Guys, safety
all.
first. Okay. Okay. All right. Okay, so good. Eyes closed for me. Thanks, Alex. And remember, guys, this one's random. We just want to know if they're able to differentiate. Okay. Is this dull or sharp?
Dull.
Okay. Is this dull or sharp?
Sharp.
Okay. Is this dull or sharp?
Dull.
Okay. Is this dull or sharp?
Sharp.
Okay. Good job. Open your eyes.
Did I get it?
Yes,
Hallelujah.
it was perfect. It was perfect. Do no harm, guys. Okay. You can just stay right there, Alex, but we'll figure out where we're going from here. Sharp, dull, jaw. Okay. Jaw jerk reflex. Guys, remember on cranial nerve 5 in here, you're not going to see muscles of mastication. We learned it as to do them to test rate the motor of cranial nerve 5. So it's easy, right? Let it flow, right? So that has to be something that's not in that box. Most docs will suggest to do it, right? So we know that is to come in, and Alex, I'm just going to again just touch your face if that's okay, and just chew for me to bite down. Good, 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 good. Good job. Sorry about that. You want me to do that again?
I think we got it.
Yeah, we get it. Okay. And then the jaw jerk reflex. This is another big one, guys, when it comes to patient instructions, right? So we are going to have Alex, so we're going to explain to Alex, we're going to be testing a reflex on your face. Okay, so you are going to feel a little hit on this. Guys, remember, there's a lot of people we're going to see that have been hit or have been all sorts of not good things. We have to think about that because they need to feel safe with us, okay, if we're going to help them. So Alex, I'm just going to ask you to look forward, and I'm going to be testing reflex, so it's going to feel like this on your face a little bit, okay? And it's going to be on your jaw. So you can keep your eyes open for now. Okay, what you're going to do is you're going to have your mouth just kind of just be open naturally. You can let it just go open like this. Okay, good. Yep, and then you can close your eyes. And I'm going to come in right here, and then I'm just going to go, okay, good. And we saw a little touch there where she came up. That's the reflex. All right, that's trigeminal nerve, guys, and we're still moving through the cranial nerves. Okay, we have facial. Facial, if you remember, let's just have them. Okay, Alex, let's see a big smile for the camera. Big, there it is. Okay.
Oh, scared everybody.
Yeah. so now sad face. It's midterms. Sad face. Okay.
Sad.
Okay, mad face. Brows up and down. Yep. Good. Can you whistle? All right. So we know that cranial nerve 7 is doing great. Moving right along, we have Weber and Ryan's. Guys, you're gonna want to add in here. For whatever reason, when you get to Weber Ryan's and the cranial nerves, you're gonna want to add in Romberg's and Mittelmeyer's. You can see actually in preparation of doing this today with you guys, I already made sure, I know you can't see from there, but I made sure that was in there. And if you look at my patient files, you'll see this on their patient files, and you'll see positive or negative, right? So just remember that when you get into cranial nerve 8, okay? So cranial nerve 8, guys, we have our trusty, what was he thinking? What's the name of this thing again? Tuning fork, yeah. I was gonna say pitchfork. It's a Friday here, guys, just so you know, okay? All right, so Weber's, remember, is the ears. Remember, the big thing with this, we wanna make sure that this is facing forward. Again, you know, we're behind the patient, we're used to it now because we're talking about it. These are things that you wanna make sure as the patient's getting more comfortable with you, especially me as a man. This is a woman, I'm behind her, I have this weird looking thing they may have never seen before, right? So communication is extremely important. So Alex, what I'm gonna do is you're gonna hear something like this, hear that? And I'm gonna be putting this on top of your head. So for this test, I want you to tell me to hear both ears equally, okay? Make sure it's on, guys.
I don't hear anything.
Okay. And then, you know what, if that's the case, if you have one that's a little older, guys, you can just do this. It's a little louder.
Yes.
And you hear it equally in both ears?
Yes.
Okay, great. Now, next one, guys, Renee's the instructions. We want to make sure that we get them right? We're going here, right? And then if it's a woman, we're just going to ask her which is the tell. We're going to be going behind her ear, or anyone, for that matter. Mastoid right here. And then we're going to be going then out here. Remember this time, again, for Renee's, that we want to make sure that the tuning fork is facing, again, forward. Okay, like this. It's never like this, never like this. It's like this, and it's like this. That's a big thing that docs are looking for. Okay, so that's a 2-to-1, so we can do that. So, and then we explain. So, Alex, we're going to be hitting this again, and we're going to be putting this on here. I want you to tell me when you hear it, and then when you don't hear it again. Okay? And then we're actually going to be moving it, and I'm going to ask you the same thing again. Okay? Remember, guys, we're looking for the 2-to-1. So we'll start off. Sometimes as these get a little older, you need to use this sucker. Do you hear that, Alex?
Yes.
Okay. Tell me when you don't.
No.
Okay. And do you hear that, Alex?
Yes.
Tell me when you don't.
No.
Okay, and you guys notice that, and then of course we do that bilateral, okay? Real good way to quick test ears. For Romberg's and Mittelmeyer's, we're going to ask our patient to stand up, right? And then you can come right back here. Yep, oh no, yep, there's good, yep. Remember Romberg's, Mittelmeyer's, guys, quick test, just look at balance, look how we're doing, okay? So the first thing is, remember, we are always protecting our patient. We don't have to be like crazy like we were maybe in the example. We want them to know that they're okay and they're not going to fall. We have older patients with issues. These become very real things very quickly, okay? So we're just going to ask Alex to kind of just stand straight, again with our eyes open, and now we're going to ask her to close her eyes. Do you feel any dizziness or anything? Like a little bit, it's been a long week. Okay.
But you said you got me, right?
Exactly right.
I'm taking care of
Dr. Will's like, I didn't see that coming. Okay, so now what we're gonna do is we're gonna, without hitting your feet on the chair that's behind you, you can march in place.
Okay.
Just trying to tell yourself good with your eyes open. And now continue doing that with your eyes closed. Good, and relax. Good. So guys, that's the place you want to add in Romberg's and Mittelmeyer's. Okay, you're gonna add that in there. You can sit again, Alex. Good, and now we're almost through the cranial nerves, guys. 9 and 10. Okay, you're gonna see in 9 and 10, it's like you're gonna say gag response. Well, we learned that we don't do gag response, and we don't. So you cross that out. And how I like to do it is I put in there, say ah, right? Because in class we learned to say ah. So that's a real easy way to do it. We want to cross off gag response, and say ah. So there's no confusion for when you're with your patient in there, okay? So remember with that, we are coming in. Okay, Alex, you can keep your eyes open. Kind of just look straight forward. I'm just going to ask you to open your mouth nice and wide. Good. And guys, you can get the pen light in there, right? We have one right here. Okay, nice and wide, nice and wide, nice and wide. Okay, and tongue out a little bit, tongue out, and then say ah. Good. Now we just tested 9 and 10, right? We're looking, remember, for the sounds to come up nice and even, right? No deviation, things like that. Trap and SCM, right? We keep it moving. Trap and SCM. I'm sorry, spinal accessory nerve, we're going to test trap and SCM. So we're just going to ask, okay, so push up against my hands for me, Alex. Good. Now, Alex, I'm just going to put my hand on the side of your head. Now turn your head against my hand. Good, good. Now turn your head against my hand here. Good, good, good. Great. 11 is good. 12. Okay, stick your tongue out. Stick your tongue. Okay. And up and down, side to side. Okay. Now, what I want you to do is I'm going to put your tongue, yes, in your cheek. Good, I'm going to push again. Don't let me. Don't let me. Don't let me. Good. Now on this side. Good. Okay, guys, those are the cranial nerves. Okay? And those, pretty sure, yeah, I noted any changes that might help as you're moving forward. Okay, going into the eye. Inspection, we know, right? We're looking for anything, and you say, okay, I'm just taking a look at your eyes now, Alex, you know, because maybe she doesn't understand what's going on when you're like this, right? So she's like, okay, what happened? So communication. Okay, so inspection, palpation, right, guys? Make sure that when we're palpating, we're going around the eyes, and maybe we can show them here. Now, I don't know, for me, guys, I would want, you know, maybe gloves or something else or like that, but just remember we're palpating. We're just gonna have you close your eyes. We're just going around the globe, right? Looking for tenderness. And remember, we're gonna first ask, do you wear contacts?
No.
We would hopefully know that in the history by now because we're way past that. We're in the exam portion. But then remember, we press on the globes, right? Okay. And we just check for any hardness or anything to that. Okay, so palpation, red reflex. Number 15, guys. With the eye, you know, which is, as we all know, takes a serious amount of practice. Left eye, left hand, right? 15 inches. I'm just going to ask you to look forward. And guys, when it comes to red reflex and the retinal exam, again, these are something where you want to do these together, kind of like we learned, even though they're separated into separate things, right? So we're going to kind of come in. You just look forward for me, Alex. Good. Okay, red reflex. Now I'm going to come in and tell her obviously what I'm doing. Okay, Alex, you're going to continue to look forward. Okay. Now I'm going to come in close. Now I'm just going to be taking a look at your eye. Okay. Remember, guys, now 8 times clockwise, right out at least. Okay, good job. And then obviously, guys, both sides. Okay, did we get that?
Mm-hmm.
Okay. So we have that both eyes. Now, guys, that's the eye exam. Now, notice you'll see on there convergence, but you're already going to have checked in there. You did convergence when you did your cardinal field of gaze, and we know that that's good. So far these things are normal, fantastic, right? So now we're going to the ears. Inspection. We're taking a look, right? Looking for any discharge, right? A lot of times we have kids and everything else, and we all know the awesome stuff that chiropractic that we've seen overtly has done with ear infections, right? And with kids, we want to, obviously, I know I had a whole bunch. And then palpation, remember guys, we can do this at the same time, really, right? Just come in here, any pain with that, any turnness. Right, we want to pull guys like right here, push the trachea against the head, no pain. Okay guys, now we go into the ear. We want to be very careful with this. And in each of your packs, you'll have something, where did I put them? You'll have these, that's what these are for. Remember I had these in a bag forever and I had no idea. I thought they were, you know, some sort of like utensil or something. I was like, what is that? Okay. Come on. And guys, obviously, you know, cleanliness, make sure that this is on right. Make sure you have it open in such a way that you're not opening the tip with your hands, right? Things like that. We want to make sure that hygiene is very important. Again, you know, we know that with the ear, right, left ear, left hand, left eye. And we're going to ask Alex to just kind of come over like that, just a tad, good. And we're just going to be taking a look inside your ears. And remember guys, we pull out a little bit. So what I like to do is come right here guys so I know where I'm at. Feeling me? And that way I'm not shoving anything into someone's. And this actually, you can really, this takes less training than if you ask me than the eye. Well, you can really see in there, and yeah, and like it's something that even I've already had an experience where this has revealed certain things that in doing this, it was kind of. Yeah, it's kind of cool. And then we're going to do the same thing. We're going to ask Alex to go this way, right here. And again, guys, these very, very fine specifics. If there's something in the videos, then that's something that you would want to take that as, you know, what you should do over if there's little things I'm missing here. Okay, and then good. And Alex is over there, right here, right hand, right eye. I'm going to come in here like this. You know where I am.
You say you take that one time a day, every morning for the nerve pain, and then you keep 4 days a week. Yep, not Friday, Saturday, Sunday, right?
Okay, guys. There we go.
And then you take.
So that's the ear exam, and if I, okay. And we are to the ear. All right. Now we're going into the thorax. All right. Do we have paper in here for? We don't need it just yet. Oh, we have it here. Great. Okay. So this stuff I'm not going to need now. A lot of our tools we can put away for a bit. We're going to need our stethoscope again. Okay. So, you know what, guys, if you ask me, this is what I've been doing. I haven't done a whole many yet, but the ones that I have been doing is that this person's already sitting right here. I'm going to go right into lymph nodes. It just seems to make sense. It's pretty easy. You know, as far as flow, again, that Dr. Bowles has been talking to you guys about. So we're going to kind of go into that. And on here, on the lymph nodes, we've learned a lot more than are on here, right? So you'll see occipital, what they're talking about is the suboccipital, where we start in the back. Okay, when they talk about the cervical, they're talking about the anterior and the posterior, right? Supraclavicular, right? And we can do those. And then under other, I usually put, just like we learned, is the submandibular, the submental, ones like that. These are things we want to know. We're feeling lymph nodes, right? That can indicate a lot of things, important finding. So just kind of like we learned, you know, we'll start in here. And so I'm just going to be kind of just feeling around, Alex, okay, for just your lymph nodes and just do a little exam on that there, okay? So we'll come back, you know, just like we learned in class, right? They feel like little like nodule thingies that we'll feel. Nothing in there, and then you can relax. Good. And I'm going to come the auriculars, carotids.
Chris, can I get you to be on the other side?
Yes, ma'am.
Thank you.
And then, so we were doing the auriculars, right, and the carotids, submandibulars, submental. Now, when we get into the anterior, we do them one at a time, right? Because the carotids are there. We go all the way up. And don't feel like you gotta go back and forth. It's foolish. Just come in here.
And you said now you kind of have a limp.
Just your cervicals. Okay, and then for the cervicovicular, we're just going to ask the patient to come in. It just helps a little bit. She's going to put her hand on her hip like that. And remember, everything's skin on skin. You know, again, communicate that to the patient. Alex, I'm going to be touching you on your skin. I'll be pulling this down just a little bit, okay? Remember, supracavicular, guys. We're going to come in here. She's going to have that. And sometimes they have them a little back like that. And then we do that both sides. Remember that we're also going to do, and if some of these are on here, so we just did all those, we did supraclavicular, all the cervicals. Remember axillary first thing, ask somebody if it's ticklish, there's some seriously ticklish people out there, you know what I mean? But they might not be used to that. So Alex, are you ticklish? No. No, okay, so what we're going to be doing is, if it's okay, we're just going to be checking some lymph nodes here and then your armpit area, okay? Remember that the trochlear, guys, is important. And then we're going to come up. Remember there's 3 points. Middle. Posterior, right? You on the front side of the lap. And then the back side of the pec. Switch hands for that when you come to the anteriors, okay? Again, make sure your patient knows what you're doing, right? Because these are sensitive areas. So those are our lymph node exams, so that's done. Okay? Now it makes, to me, a little more sense, and now we'll go into the thorax, okay? And we'll take a look at those things. So, I think the best way for you guys to see for that is, Alex, you're gonna come up here. Yep. And you're gonna come up right here and face that way, I think is what makes sense, yeah. Remember guys, everything is skin on skin. I mean, we can't do fremitus if it's not skin on skin, right? I mean, so, Alex, if it's okay, I'm going to be opening the back of your gown and be examining your back here, okay? Guys, kind of like we learned in palpation, I mean, for something like this, we can go like this, we can open it, we can either take it like that, or if the patient's more comfortable, we can put it into her pants there.
Are female patients allowed to have a sports bra on, or are they supposed to be completely?
Typically downstairs we do allow some sports bras to be worn, yeah.
Okay. So first thing is we're inspecting, right guys?
Pretty random.
We go right into our palpation. Remember for this, we're just asking the patient, remember the lung feels, guys, how we learned? And we're asking the patient to just let us know if there's any tenderness, right? Remember we're going inside the scapula, around the scapula. Remember we have to go inside, so the lung's in here too. Right.
Is the sharp pain?
You guys know if there's any pain, tenderness.
Way down or?
Fremitus, remember guys, fremitus 99, right? So, Alex, when you feel my hands press against you, I just want you to say 99.
Okay.
Okay? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay? Now, again, guys, the little variations, you might see some come through the scapula like this. Certainly going to need to do that on the front side, right, when we get there with instructions there. Percussion, just let them know, okay, I'm just going to be doing just checking here, okay, you just continue to relax, right? And normally that would be skin on skin, remember, back and forth.
Oh no. Okay.
And remember guys, we're coming over to the side.
Yeah,
right?
I bet.
And all the way over. Alice can tell you, she probably can feel that. You can really feel it. You try not to do it, of course, too hard. You know, just enough where you can feel if there's changes in the
I
thing.
feel pretty strong. Weak.
Percussion. Okay. Diaphragmatic excursion, guys. Remember that's bilateral, right? So we're going to start off from T12. We're going to go down. And as we're pairing, easy way, apply T12 bottom of the ribs. Okay. Nice easy way. I'm pretty sure that's even the way that Dr. Gibbons says it. And just get ready. We're going to do both sides. We'll do this one here. we're just gonna ask Alex to take a deep breath in, okay, and hold it. And blow it all the way out. Oh, we actually do that opposite, guys. We do that opposite. Okay, so you're gonna take a deep breath in, then blow it out, and hold it when I tell you. Okay.
Hold on. What are you gonna ask me to do?
So you're gonna take a deep breath in, and yeah, and blow it all the way out.
Okay, before
And
you
then
start.
yeah, and then you're gonna hold it out. We're
Okay.
gonna start there because we want to
Okay.
see what the difference is when the diaphragm expands. I'm sorry, guys. I had that opposite.
Okay.
Okay. Yep. And blow it all the way out, and hold it out. Okay. Deep breath in, and hold it. Hold it. Okay, right there. Okay, and relax. Okay, guys, and then we're gonna do that on both sides. Okay. Respiratory excursion, guys. This one is the one where we're coming around like this. And any place that's comfortable, remember skin on skin, kind of tell the patient, I'm just going to be kind of grabbing your sides, okay? We're just testing your lung capacity, okay? And you come in like this, not too hard. And you come in, take a deep breath in, deep breath, and blow it out. Perfect, and relax. See how my thumbs were looking for those to come nice and even like that, okay? Good, so that is respiratory expansion. Auscultation, guys, we're doing that. Thank you. Okay, guys, diaphragm. Remember, just across. They're going to breathe normally, but when they feel it, the diaphragm on them, they're going to just be taking, slightly the normal, kind of bigger breath, but they don't have to, in and out. And remember, it's the same pattern. Always test it, right? And be like, oh no, I'm not hearing anything, right? But they're, yeah. Case doctor. Okay, so you're just gonna breathe.
They're dead.
Yeah, I don't know what to do. Should I adjust Atlas or? Doctors laugh, guys. It's very important. Okay. And then I'm just gonna be listening, right? And guys, in the same way, a full breath in and out. A full breath in and out. So you want to keep it on there. Alright? Full breath in and out. In other words, we don't go boom, 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 boom. We're not hearing anything though.
And then, let's see, you said 27 to 28 years is how?
When you start doing this enough,
No?
you start to at least have an inkling of what, as you practice, what normal is. I've yet to hear something abnormal, so but I'm starting to know pretty well what normal is. Obviously, through the sports bra, this is very hard. So you'd want to, come in here like this. Good. Yeah. Okay. And then around. Good job.
So that's when you think you got.
Alright guys, so that's our auscultation. You remember, and then of course you want to come all the way around. So we're going to be testing, making sure that we're going in the same pattern for our palpation, percussion, auscultation, right?
Okay.
So now we've just taken care of our posterior thorax. Now we're going from where the patient's up and now where the patient gets to kind of like rest, right? Because now we're going to go in, we're going to be doing anterior thorax, heart, and abdomen, okay? So I'm going to have you, I'm going to find some paper, Alex. Dr. Bowles was pointing to it. Oh, was it these things under here?
Mm-hmm.
Oh, that's good. Okay, Alex, so I'm going to have you just come down here. I'm going to actually, I should have done this a little earlier, guys. We're actually going to just leave this one open. We're going to find out later in a second. It just makes it a little easier when we get her down. So she doesn't have to try to do it. Just laying down. Okay, so I'm going to have you just come down here on your back, Alex. Good, and you just lay straight down, put your head down there. Good, and then relax. Are you comfortable?
Yep.
Okay, good. Okay.
Mild, moderate, or severe?
Now, guys, everything pretty much we're on the patient's right. It's that easy, right? I think in certain things it doesn't matter, but in most things it does, so.
So I would not have any change.
Patient's right, right?
Have to change
Yes.
the way
Okay.
we're dressing to the
How I check?
Dr. Field was just telling us, I always ask her, what's that leg that hurts again? Because you want to keep checking. Sorry. Okay. Anterior thorax. Okay, guys. Okay, woman. Right, man. Instructions. Very, very, very clear. Again, even if this was a person, any person, but you know, we want to be very clear because they want to understand that what we're doing. And frankly, in most cases, in most people's lives, they have not gotten a physical nearly as thorough as this. Okay. So, if it's okay, Alex, I'm just going to be kind of pulling this up. I'm going to need to look at your chest area. Okay, we're going to be examining that area and making sure that everything's okay. Now, the hope is that when I left that open when she got down, this makes it a little easier to bring it up for her. And it didn't work out completely as planned. There we go. Okay. And now, for the chest exam, anterior thorax, we can start here and notice that we're keeping her covered here. Okay. Inspection, guys. Okay. Looking for lesions, anything that we've talked about in class. Right. Palpation. Guys, this is the same idea. I think, Doc, I'm not sure if you might need to come over here, but just let me know. Now, guys, palpation, okay? But how this is going to start is that this is going to be kind of, it has to be skin on skin. So in order to start doing this, right, around the rest is that we're going to bring this up, so it's going to be kind of like a tube top for the patient, okay? So we're going to bring this up, and then this is going to actually help us. We'll go right into not only our heart but then our abdominal exam, so she doesn't have to do like this too long, okay? So we're going to have this area like this here.
And then for standing, some pain when
Alex, I'm just going to be palpating this area here to see if there's any pain, okay? And guys, remember that the anterior thorax member, we always start above the clavicle. Can you see okay there? Mm-hmm. Yeah. Now we're coming down. Now what we're going to do is, this is when the breast instructions start, guys. So Alex, what I'm going to ask you to do is, take your breast tissue and please push it down for me. Any pain or tenderness? Now I'm just going to ask you to kind of spread apart the breast tissue. Yes. And guys, to be safe, we can come in here like this. Any pain or tenderness there?
No.
Okay. And now I'm going to ask you to lift up. Thank you.
I think just being able to.
Pain or tenderness there?
No.
Okay. You guys, we're going to go right into that, almost our same exact thing. Now our firmness, just remember like we did, Alex, we're going to do the same thing again, okay? Good, and then press down for me, thank you, and then you just say 99.
99. 99. 99. 99. 99. 99. 99. 99.
And lift up, please.
99. 99. 99. 99.
Good. Now guys, depending on the case, like how you're doing this, sometimes you can have it where you can do most of everything in the upper area, but that's just not logistically possible for some of this. Okay? But you can think like that. When we get to the heart, we'll see that. Okay, I just want you to relax. Just examine for a question, guys. Remember, back and forth. And please just push down, press the shoe. And just separate, please. Okay. And now lift up, please. And goes back and forth.
Work, house, school, or school activities. So unable to perform, or extreme difficulty, quite a bit of difficulty, moderate, a little bit, or
okay. Good job. And now we auscultate.
Too much? Don't do much because. Okay.
Test it. Test it gently. Well, not the hard way ones. Okay, and then you can just breathe normal from your Alex.
Do you feel like you can't do anything?
You can move your breast tissue down, please.
So for your usual hobbies, recreational or sporting activities, don't do them? Okay, just because
Now you can separate. Now obviously guys, we'd have to come in here and we'd have to have a gown that's open here. It's actually here through here. Okay, we can come like this. if there's any severe regional concerns, we would, of course, pay closer attention. Now we can lift. So yeah, guys, I'm kind of working with the sports
Unable, quite a bit of pain,
bra.
moderate, a little bit.
Obviously, you need to be skin on skin.
Yeah, just like walking around your house. Limp. Okay. So would you say quite a bit of difficulty or moderate? Okay. Putting on shoes
Almost
or
there,
socks.
Alex.
Unable to do it, quite a bit of difficulty, moderate, limp. Quite a bit. In your hand. Okay. How about squatting?
Great job. Okay. Now, guys, as we're preparing, we're not going to need this up for the heart, so we're going to bring this down. We won't need that up again, but that's prepared for us to bring up for the abdominal exam, so we don't have to keep, having her mess around too much. For my male patients thus far, we've all been comfortable taking their shirts off, so it's been, it's with the woman that we need to maneuver around. All right, guys, we're in the last column. So we're getting there. I'm not tired, so you better not be. No. Okay. So now, go into the heart, guys. And we are
Getting in and out of your
this
car.
back, guys. Now we're gonna have her bring this down. Just like that. Right, guys. Remember, APET monkey, right? We're gonna APET monkey. Inspecting the heart now. We're as far as inspection, we're looking for anything obvious. Now we've already inspected the anterior thorax, so you're not gonna have to sit here and say, oh, now in my mind, now I'm gonna inspect the anterior thorax again, okay? Palpation, remember, is deep and superficial. We're gonna find out where it's supposed to be. I'm gonna ask you, Alex, to really kind of pull your breast tissue down for me. With the heart, guys, this is the one where you can work on top and then work the tricuspid and the tricuspid and the mitral on the bottom. Okay, so you can do all this stuff on top, all the stuff on the bottom. Okay,
How about
just easier. Okay, so we're gonna find. Remember, superficial. We're feeling for any touching for thrills, right?
okay, how about standing for an hour? Do that? No,
And depending on the videos you might see, they might just have doing one hand. I can't remember that at this point, but you're feeling for thrills. Then remember, we go back to the same spots, going deeper for tenderness. Any tenderness with that, Alex?
Making sharp turns while running.
If I remember correctly, a second intercostal on each side that we're feeling, then we go down to our third.
Rolling over in bed. And we'll get ready for no bounce okay.
And now what we'll do is lock the tape up here too. So please continue just to hold that down for me, Alex.
Or even less than that. Once a month, maybe. So every 8 months, maybe.
Now guys, just see the notes, they say about 10 seconds. At this point it starts switching from academic and you start saying, okay, am I comfortable? I'm not hearing anything that shouldn't be there, right? I believe, do I remember that correctly? Was it about 10 seconds per spot? Yeah. And just belt, right?
Okay.
Oh, it is belt, okay.
What we're going to do next is we're going to do a spinal check on you. And then...
This one you can even start hearing that. Right. Okay, guys. Yeah. You're healthy as a horse, Alex. I don't know what you're talking about. And again, guys, it would be, they say about 10 seconds per point. You want to see if you're hearing anything. You want to make sure that you're comfortable that everything's okay there. Obviously, if you were doing this for any other reason, that specific regional exam the case doctor had, you'd be paying even more specific attention, right? So now guys, we switch over. Now I don't think we need to do all those things again, but what we will do is we'll show that now Alex is gonna be able to, now we're gonna take this up, right? So it's more like the tube top kind of thing again, right? Now Alex is going to lift up for us. And now everything we just did, we are gonna do on our last 2 points, right? So nacovicular line, tricuspid, and mitral, okay, guys? Mid-axillary. So we're going to do our palpation, superficial, deep, right? Auscultation of both. Okay, both using the bell and the diaphragm. Okay, on these 2 points too. All right, so we have A, P, E, T, N. Okay, and now Alice can relax. And that's just easier that way, guys, on the female patient. And that's like according to Dr. Gibbons' instructions. Guys, it says on here auscultation of subclavian. So what you do, so let's do that. That's the bell.
Yeah, that would be great if we could see that. We'll just have to get them here just to have like our own set, because we take them a little bit differently. We take these ones like standing up, so that way we can see like the axial pressure that is on your spine. So they're just $30 for the one set. So we'll get those scheduled. I'll walk out with you when we're done. We'll get those scheduled, and then that way next time you come in, we'll get those taken care of. Get your just a very small physical exam done, and that way we can get you adjusted as soon as possible.
As that is our cardiovascular exam. I was going to put this away if I don't think we're going to need it. No, we're going to need the abdomen. Okay, guys, abdomen. Obviously, we're going to, Alex is going to be able to have this covered now again. And we're going to tube top in a sense from the bottom up. So, again, patient instructions, Alex. We're going to be doing an abdominal exam on you now. You're doing great. We're almost through the physical. Okay.
Great.
Now guys, we're gonna just a tad bit down here like this, right? Because we're looking at our quadrants. Right. Now you guys notice how the big thing that Dr. Ball's been talking about, the flow of this. See how we're doing everything we can to kind of start to put this all the pieces together and have this flow. Not only for the patient, but for yourself. So, vowel sounds, friction rubs. Let's set in there first. Now there's some crazy number that's normal. Do you remember that?
5 to 35.
5 to 35. Oh, that's so much better than 5 to 34. They changed it.
I think it's 5 to 35.
Is it? Yeah, no, I think you're exactly right.
Dr. Bowles knows better than I do.
Is it?
You're in the ballpark.
So guys, we're gonna come in here. You know, the notes say that we want to know what's going on, how many vowel sounds. And we're gonna go, guys, once we have in our first quadrant that we do, once we have them to move efficiently through this, right, then we're going just until we hear them in the next quadrant. Good. Okay, somebody had a cannoli today? Good.
No.
She's like, I have none. Huh?
Not in a while.
I don't need enough. Okay, so there we go. We have those guys. Why don't we move right into friction rubs, because we're right here, right? As much as we can do that makes sense to do. What's going on? We're checking the patient. So good. We got our vowel sounds. We got our number in the first quadrant, right? Heard. Moving on, friction rubs. Start here. What I'm going to ask, Alex, if you just take a few deep breaths in for me, all the way and all the way out. Good. One more. And then we come over here, guys. Same thing. And then we would have her come through. Keep going.
Yep, feet here. Oh no, you can use this one. I promise. It's okay.
And we're doing great there. And then just relax and breathe normally. She's doing great. And sometimes you want to check in with your patient because she's been doing a lot of deep breathing. Alright guys, I'm just reminding myself and make sure there's no more auscultation because I don't want to stop auscultation now, do palpation and come back. And if we follow this exactly, that's what would happen. And this is the flow that Dr. Bowles is talking about to kind of think through this. Okay. Let's auscultate the arteries. That's gonna be cool.
Do you mind if I bend my knees? Because my knees
Not
are
at all.
blocking.
Not at all.
Oh, Jesus. Okay, perfect.
Actually, that's a really good point, guys. Technically, I don't know. It'll be more so when you get to palpation. Remember, technically, I know this is we're supposed to be bent, right? If I remember that correctly. So, specifically speaking, it should be bent. That's definitely very important for palpation. We would have got there. We would have felt the difference. So we didn't, but have those knees bent. Okay. Aortic.
If there's anything that's tender or sore, let me know, okay?
And those iliacs.
Right in there. Any pain when I was touching there? Or you just know that it's just didn't work? Do you mind if I lift your chin up a little bit?
Okay, guys. Brewery's there. That completes our auscultation. Holy. For the abdomen, now we're going to go in. Let's see what we have here. Okay, guys. Let's go to palpation. Guys, remember, circles, right? This is the one where we kind of come in here to support. Tenderness, then the large circle or larger. Now the deep, guys, I don't think we need to subject Alex to that, right? But the deep is deep, right? We're going to go in the same pattern. Right? And we won't delineate any kind of masses or anything that we just might feel, something that's abnormal there, okay? So that's our palpation. Remember, we also have palpation of our aorta. Remember, that's very important, guys, right? We could be thinking AAA, something like that. These are all findings that are really important, right? So we're going to come in, start in here. Notice the fingers. Feel it. Still feel it. Don't feel it anymore. Maybe just a tad, let's go a little farther. Right there. Right there, normal. Okay?
I'm just gonna clean your neck now, okay?
Now we're going to go into our... Okay, good, we're doing great. Now guys, we're going to do our percussion. So we're going to do size, and then we can finish with our palpation. If it's easier, you can do palpation, but that's the most. Right, so guys, we're going to start off here. Percussion of the liver. That's the difference. Marking that. May I ask you, Alex, again, to lift up for me, please? Good. Please hold up there. Thank you. Okay, now we're going to come from here. Not that comfortable, right near the solar plexus. Okay, choke space. Good, she can relax. Now, let's see, did we miss anything thus far? No, I don't believe so. Good, good, good. Remember guys, the abdominal exam is definitely somewhat lengthy. Okay. Now, palpation of liver. Remember, we're going to do this. I'm not going to do it full on Alex. There's just no reason to do it on her, and it is uncomfortable. But we're going to have the patient, remember, we're facing this way, our fingers, right? And we're going to have the patient take a deep breath in, blow it all the way out. And then we go all the way in underneath, right? And then we ask them to breathe in, and then, oh, and we feel it. Okay, same thing with gallbladder. Remember, this is Murphy's sign, which is at the end of the list. That's why if you're doing this with your liver, this is what we're talking about flow. You're going to do those together. Point our fingers this way. Deep breath in, blow it out, and we're going all the way in, guys. I mean, really in there. And then deep breath in. Looking for any tenderness, anything like that, right? Murphy's sign. I believe that we just did everything. The abdomen, kidney. Remember guys, on the right side for the kidney, we're going to come in and down here, explain to the patient, I'm going to be putting one hand underneath you, okay, like this. Good. One hand on top, remember, we want to be going this way. Deep breath in, blow it all the way out. Remember guys, all the way down into that guy, all the way down.
Whoa.
Yep, and then deep breath in. So, then you feel it knock against you.
That really hurts.
It's really tender, right? So we want to be careful with that. So we have, that's our palpation. Okay, then we have, I don't believe they have Murphy's punch on here anymore. Remember that McBurney's point and Rosling's, right? We always do Rosling's first. So we come down lower quadrant, right? We come down here. We're going to kind of just go in like this. Pop up, look for pain, diverticulitis area, right? With appendicitis, this can actually cause pain over here as well, right? We're going to come over here, then we're going to go appendicitis, McBurney's, same thing.
We'll get your x-rays taken, we can do your, just a small physical,
And then if any of those problems existed, that would light them up.
Make sure we get you adjusted as soon as possible. So I will walk up front with you.
And that is everything. I don't believe that we have Murphy's punch on here.
You don't?
Good. Okay.
I don't know if that is added in there or not.
They have been teaching it. Maybe we'll just show it just in case,
Yeah,
guys. You're gonna do
okay.
this last. You're gonna have your patient get up. She can actually face this way since the camera's already this way since the camera's already over there. And
Better to be thorough than not thorough.
right, yeah, and then we could remove. Okay, guys, remember kidney punch. That this is the percussion, right, of the kidney, right. So we're gonna come in here like that, and it's gonna be a solid boom. Okay. And if there's any problems with the kidneys, this is that they're gonna know it. Okay, and then normally, although it's uncomfortable, it's not something that she's necessarily gonna feel a lot of pain with, right? Okay, so here we go. Abdominal exam. Now guys, as you can see, when they were already sitting, when it made more sense, we already did our lymph nodes, so we're good there. Pathological reflexes, Babinski. I don't know if anyone has done the abdominal at this point. Are they doing that?
A what?
The abdominal reflex?
Yes.
Oh, really?
Yes.
All right.
We've seen how it's done, but we've never really done it.
Okay. Dr. Rose wants that done. Okay, so, guys, for the abdominal, you can finish off with this however you want to do it. Obviously, when the patient is still down, okay. And then why they're still open here, and then we're going away in the quadrants like this, and we're looking for a jerk that's towards the butt.
I thought you went in.
Do you go in on
Yeah,
that one or
yeah.
out?
I think you go in, yes.
Oh, and then there's a jerk towards it, right? Yeah.
Correct. People get that backwards on the exam.
As I have.
Way to show them what not to do.
Yeah, I know. Now that is what you don't do. This is what you do. Okay, so if that's your abdominal reflex, obviously you want to get that done, even though it's in a different section, right? Get that done while they're still down on the table. Also, while they're still laying down, cover them up. So she's done there. Then we're gonna do Babinski. Remember, Babinski is that it's gonna go from the lateral side of the foot over the toe, and you kind of got to dig in a bit. So if they actually had something like that, okay. And of course, we're gonna do both sides. Okay. So those are our reflexes, or pathological. I'm sorry, pathological reflexes. Good. Now we're going into our orthoneuro.
Did I have any?
Pathological reflexes? No, you're great. I mean, right?
That's gonna come out of the video.
HIPAA. Okay. Guys, now we go into our ortho again. So we have an ortho list. There's been at least twice so far of where I've added to this, okay? If I wasn't convinced that just the Gainslands, let's say for SI, well, I add another one's Gainslands. It's just, we know how to do it, right? If I'm concerned that the person has an SI problem, I'm gonna do those ortho tests. And if they are positive, if there's a finding, maybe it's not technically positive, but there's a finding, right? That's something I'm also using as an objective marker, and your case doctors are going to see as you're moving forward. Are those ortho tests that were producing a problem that shouldn't, right? Are they getting better? So what does that look like, right? And then of course, so we're gonna do those together. And then we're gonna finish with our neuro exam, okay? And I gotta tell you, I haven't, even in just my limited time of doing this, I haven't found something, pathological yet. I've found things that are within normal limits, but it's been very interesting to see decreases in differences between side to side, both in reflex and in motor. And tracking that as well with your patients as you're moving forward and clearing out their nervous system. So all of this, again, is data that is important, and it's what we're using to watch the progression of our patients from a functional standpoint. Okay, now, if we're gonna do all the cervical tests,
We all know how to do them. I think
yeah,
it's just a
are
waste
we
of
okay
time.
with the test?
Okay.
I think it's a
Great.
waste of time to
Okay.
do them. This is when you do them and you've finished.
Right.
You've started off with whatever.
Yeah, it's
Cervical
usually
compression and ended with gain length.
Yeah, basically you run down that list
Yeah,
and
and
that's
we
it.
get that's pointless. That's another 30
Yeah,
minutes. We do
right.
not.
When you get to the orthos, you're on the home stretch, and
Yeah.
basically you just go straight through those and make sure you do the dermatomes and have them
Yeah.
close their eyes. A lot of people forget to have them
I
close
mean, we
their
can
eyes.
do that one. That I don't have a problem. But
the neuro exam
tests,
too? We're good?
I think we're good.
All right.
Yep.
Neuro C2.
It's
that's
funny
fine.
too, because when you get into the orthos and NMS, that's when you really start feeling comfortable. Because
Yeah.
it's like you don't realize how trained you are in that. But it's like when you come to there, and it's, again, these provide very, very important and interesting findings for us. So is there
Yeah.
anything else you guys
No, I
think
think
that maybe
that's
that
pretty
we've
good.
covered?
Thank you guys. I appreciate it. Say
No
goodbye.
problem.
Bye-bye.
Bye.